Hi, I'm Vicki, Sykes. I'm a nurse practitioner student, and I'm here to do the cardiac exam. Um, and I've just washed my hands, and this is my patient. Do I have your permission to record this video, perform the exam, and post it on YouTube for evaluation by my professor?
Yes.
Okay, phenomenal. So the first thing that we're going to be doing is, let me grab my pen light, and we are going to pretend that he does not have a shirt on, and we want to do inspection first. So I'm going to use the pen light to go across his chest, and this is called tangential lighting, to inspect for areas of pulsation, especially the PMI, which is a point of maximal impact. And then the most important thing that we're going to be doing right now, do you mind turning to that side, please, is assessing for the jugular vein. The jugular vein right here, as you can see, and if you shine it, you can see the point of pulsation. So once you identify that point of pulsation, which he is right now seated at a 30-degree angle, we're going to get it right there, and then we're going to take the measurement, and he is about a 2. Which is very good. 2 centimeters at a 30-degree angle. While we're there, we'll also look at the pulsation on the other side. Turn this way, please, of the carotid artery. Okay, wonderful. Okay, so now that it is a 30-degree angle, the next thing we want to do is palpate. So cardiac is is not just assessing the heart, because the heart pumps blood throughout the entire body. We want to check pulses on the dorsopedalis and make sure that they're good, because obviously if they're weak, then the heart's not pumping the blood very well on both sides. We also want to check for peripheral edema or pitting edema. He has no edema, and the pitting edema is when you push against and there's an indentation. He actually has a little bit in this leg right here. It's at about a +2. And then the femoral pulse artery right here, you want to check and see that, make sure it's pulsating well, and that you don't hear any bruising thrills. All right, and that we have that one. So he's at the cardiac exam is done on 3 different angles. It's 30-degree angle, lying flat, and then also sitting up. And these angles allow for different positions allow for better hearing for certain things. And then in the end, I'll show you the specialty exams, which allow for hearing of murmurs, S3, S1. So, but for right now, we've already measured the jugular vein distension, and the next part of it is we're going to be palpating. All right, so we're going to palpate. There's actually 5 different places to palpate. On this side, you have your pulmomic, which is on the second intercostal space at the right, on the right side, right sternal border. And on this side, it's on the second intercostal space on the left sternal border. And then from 3, 4, and 5, you have something called Erb's point. And then on the 4th, you have the tricuspid valve. And then down here, mid-clavicular line, or a good way to remember is that the nipple line, and it's between the 4th and 5th intercostal space, or 4th or 5th, either one. It depends on the person. And it's at the mid-clavicular line is the apex, or the mitral valve. And that is also the point of maximal impact. So sometimes you can see that through the shirt, and it's very easy to find. So we're going to palpate. And palpate, palpate, palpate. And you always want to come on the right side because it's a lot easier. And then another thing is you can do fingertips. Fingertips, it's a lot, very important to do fingertips going and Erb's point and down to the midclavicular line, just to check for pulsations, for bruits, for thrills, and whatnot. Okay, so the next thing that we're going to do, since we've identified all the borders, is I'm going to auscultate, and then I'm going to have him sit up and then lay flat. Okay? And you want to auscultate with the bell, and that will make it easier to hear for bruits. And also the diaphragm. So we're going to do the carotid arteries with the bell. Okay, turn to the other side, please. And when you're doing Erb's point, you want to just pick up slowly, go to the next, pick up slowly, go to the next. It's a linear down the left sternal border. Okay, wonderful. And if you don't mind sitting up on this one, or just actually lay flat really quick. And just put that back there. And just lay completely down. Okay. Thank you. And I'm going to do bell and again. Okay, if you don't mind sitting up, and lay left lateral, please. And in some patients, it's very difficult to hear their PMI or to locate their PMI. So if you lay the person in the left lateral position, and this also helps listening for S3 and S4. So you want to listen with the bell as well as the diaphragm, but it's most important the bell, because in this position you can absolutely hear S3 and S4 if they do have it. All right, go ahead and sit. And as these, go ahead and sit up. And if you don't mind hopping on this table, this would be wonderful. So percussion is not something that's done typically in cardiac. If I were having difficulty finding the PMI, I would take the left sternal border and I would palpate down to be able to hear it to the point of maximal impact. So, and you can go down mid-clavicular line or left sternal border. Again, the apex is something that we have to find during this. And you want to also listen while he's in this position as well. And another artery that you could assess when doing cardiac is the aortic, abdominal aortic artery, which you just palpate. It's where's your belly? Right, it's right by the xiphoid process, and you just palpate. Oh, there it is, and going down. And you want to auscultate it to make sure there's no bruits and thrills as well, and use the bell for that. You also have your renal arteries, your iliac arteries, and your femoral arteries if you wanted to investigate a little further. But the aortic, femoral, and dorsal pedalis pulses are very important in cardiac patients to assess. Because obviously if there's backup, your legs are going to start swelling. You're going to have that peripheral edema with the +2, +3, and that's something. One last test that I'd like to do is if you wouldn't mind leaning forward, and I'm going to listen at Herb's point and at the apex see if I can auscultate for murmurs. And I want you to exhale, and then I'm going to listen. Okay, go for it. Exhale. Take a deep breath in and out. In, out. Okay, one more. Okay, and you're leaning forward. Okay, one more time. Okay. Okay. Okay, and for murmurs, it's important to listen with the diaphragm. And for like S2, S3, it's important to listen with the bell. All right, I believe that concludes the exam. Thank you for listening and have a great night. Thank you.